How you guys doing today? It's Anthony Ganji. Welcome to another episode of Tear Talk. Guys, I have an interesting case I want to go over with you guys. It's about Katrina Dukes. This is coming out of Tennessee. It's about a young woman, 40, who died in custody. So she died at the jail. And now, this happened last year, I think February of 2024. So this year, they're pushing a lawsuit. Families now involved, and they believe that there was either negligence, a disregard, indifference. They believe that their daughter did not have to die in the custody of the jail, which we'll go over specifically. So I want to show you the video, and then I have a breakdown. I would love your thoughts on this. I try to be as objective as possible, but do we have an oversight here? Did they miss something? Could this death have been preventable? Is there justice for Katrina? So first, let me show you this video, and then we'll break everything down. All right. Let me open it up, make sure you guys can see it. Yep. Okay, here we go.
Katrina, the call I got is you was asking people for drugs.
I could not get off of it because it wasn't able to use me. You see what I'm saying?
No, you're making no sense. Who the are you talking about?
My girl, you are dead.
On February 29, 2024, the Cocke County Sheriff's Office in Tennessee responds swiftly to reports of someone attempting to obtain narcotics outside a hospital. However, not everything in this case is as it seems, and officers will laugh as they make a horrific mistake.
Walking around asking people for drugs. Call we got. Like she needs any more.
The following is based on official police records, and the footage has never been seen before until now. Please note that all persons charged with a crime are presumed innocent unless and until proven guilty in a court of law. Around 7:40 p.m. on the 29th, the Newport Medical Center calls 911 to report someone asking for narcotics in the parking lot outside of the hospital. When officers arrive, they find 40-year-old Katrina Dukes.
Can I get my number?
What number?
So I'm done.
You what?
I'm done.
Was you in the hospital?
Yeah.
Okay.
Can I?
Where's your shoes at?
Yes. Can I please go on?
Where are you trying to get to?
Can I'm good.
Yeah, just advise. I'm not with her.
Will you go with me
Where are you trying to go?
to this? I'm good. I'm done with it.
Katrina, the call I got is you was asking people for drugs.
No, I'm done.
Police reports allege they were called because Katrina was, quote, harassing people for narcotics, while court records state that staff reported that outside the hospital, she was asking passersby for a number to get a fix, and that she appeared to not know who she was or what was going on.
What'd they give you while you was in here?
Huh?
I said, how long?
I'm done.
What time did you get to the hospital?
I just now got off of it.
Earlier that day, Katrina had been taken to the hospital after asking the front desk clerk at the hotel where she lives for help. The clerk noted that Katrina had been confused, lethargic, repeating incoherent sentences, and appeared to be experiencing symptoms of a medical event.
I understand that. What time did you get here?
I just now got off of it.
But how long were you here?
I could not get off of it because it wasn't able to use me. You see what I'm saying?
No, you're making no sense.
Look, okay, so this is where it's not able to use me. See it?
Uh-huh.
Court records state that while at the hospital, Katrina had been diagnosed with diabetes mellitus with hyperglycemia and was treated for high blood sugar before she was released. The Mayo Clinic lists the early symptoms of high blood sugar as frequent urination, increased thirst, blurred vision, and feeling weak or unusually tired. However, later signs include nausea and vomiting, shortness of breath, confusion, and loss of consciousness.
See it?
Yeah.
So I'm good, but I can't. Can I please go to the
Katrina is holding what is believed to be her discharge paperwork from the hospital, which would have included her diabetes diagnosis. She'd been released only a few minutes before hospital staff called the police.
What are you doing? What am I doing?
You're under arrest.
Why?
Public intoxication.
I'm done.
Done with what?
No, I just now got off.
You can't even form a complete sentence.
No, I'm good. I'm telling you. I'm telling you. I'm telling you. Can you tell me? Look, it's just now went on me.
As Katrina is being handcuffed, other officers arrive at the scene. According to police reports, she was arrested for drunkenness and public intoxication, and the officer notes that she appeared to be intoxicated on a stimulant. However, while at the hospital, Katrina had been administered a drug screening for oxycodone, amphetamines, barbiturates, opiates, benzodiazepines, cannabinoids, cocaine, methadone, phencyclidine, and alcohol, and tested negative for all substances.
Oh my God! I'm not. Oh, listen. I'm not. Oh.
Is that the one you stopped yesterday?
No.
Who is that?
That's Katrina Dukes. She's usually got meth stuffed up in her, but she's high as hell. Can't even tell me what she's at.
Who you say that was?
Katrina Dukes.
Or
I got her at Motel 6 one time. She had over an ounce of meth stuffed up in her.
Court filings indicate that on April 22, 2021, Katrina was charged with possession of meth. She was then charged with probation violation on July 31, 2023.
You couldn't even tell me what time you got here, and you got no shoes on.
This is supposed to be.
And then I've got people up at the hospital saying that you're asking them for drugs.
That is not even. See, I'm supposed to be on the.
Were you trying to go to the hospital or get out of the hospital?
This is supposed to be to it.
To what?
Look, it's not supposed to be. I'm not supposed to be going to that. Listen, would you?
When you were walking, Katrina, where were you trying to go?
Would you take me? Would you show them?
What? I can't understand what you're trying to tell me because you can't. Do you hear what you're saying?
I'm supposed to be going to this.
You said it's across to my stuff, and that doesn't make any sense to me.
Please.
What does that mean, Katrina?
It's not supposed to be going to my person. You see what I'm saying?
What is not supposed to be going to your person?
It's supposed to be going to my person. Please. They're supposed to be going towards us.
Who was?
Us.
Who?
Us.
Me and you.
We.
That's us.
Okay.
They're supposed to be
And they're
going
supposed
where?
to be going towards us.
Who is?
They're not supposed to be going towards us.
Who the are you talking about?
They're not supposed to be going towards our. I told you. I told you. Please, let me tell you. What the are you doing? They're supposed to be going towards us.
What are you talking about?
They're not supposed to be going towards us. Okay, they're supposed to be going towards us to go to the country.
My girl, you are
No, they're supposed to be going towards us to the country.
Get your
Will you, listen, okay, they're supposed to be going towards us to the,
Go around towards the door, Katrina.
I'm supposed to be going across the country. You are, yes, they're supposed to be going on us. They're supposed to be,
somebody open the red
God
door.
damn it.
Watch your mouth.
no, I can't explain it to you.
Then watch your mouth. I don't want that coming out more.
Okay, can I tell you something?
Yeah.
Okay,
You can tell me what you're coming out of.
no, they're supposed to be going on us.
Okay.
They're not supposed to be going towards us.
This is the same conversation I've had for the last 10 minutes.
No, it's all right.
I guess the hospital paperwork she just got out, I guess. I don't know what's going on. She had it with
They
her.
ain't supposed to be going towards
Okay.
us.
So
what are you
going to charge with?
PI. She's walking around asking people for drugs. All we done. Like she needs any more.
According to court records, about an hour after Katrina was transferred into the care of jail staff, Her blood sugar levels were tested and came back as 360 milligrams per deciliter. A reading of 300 is considered dangerously high. Corrections officers reported that Katrina was, quote, nodding in and out and talking out of her head, not acting as she has when she has been there in the past. They decided to give her a dose of Narcan, which she resisted. The next day, on March 1st, Katrina appeared normal in the morning, but her condition deteriorated throughout the day. At 4:36 p.m., another inmate told staff that Katrina was lying on the floor of her cell. They called 911 and administered 3 more doses of Narcan before emergency responders arrived. EMS noted that Katrina was in critical condition with stroke-like symptoms. While at the hospital, she regained consciousness, but couldn't move one side of her body, and a CT scan confirmed she had experienced a stroke. She died a few days later on March 3, 2024, at the age of 40. Katrina's mother has since filed a wrongful death lawsuit alleging that after Katrina's arrest and transportation to the Cocke County Jail, she developed serious medical needs that were neglected and from which she died without emergency treatment. The case remains ongoing. If you'd like to see select new videos early and help us keep uncovering case files that rarely come to light, you'll find extra footage and unseen details on our Patreon. Channel memberships here on YouTube also includes early access to select new videos.
All right. So, guys, there's a lot here. And I will tell you one thing. It's extremely disturbing once you see or once you know the context to rewatch the video again, especially that part where she says, I'm trying to explain it to you, but I just can't get it out. So I rewatched it again after I understood the context. And it's once you get the information, as I said, you look at that video totally different. But now we're going to break down what happened here. So on the afternoon of February 29, 2024, Katrina Dukes, a 40-year-old woman living in Nights Inn Motel on Cosby Highway in Newport, Tennessee, realized something was very wrong. She was a known diabetic and had not been taking her medication, and now she felt disoriented. Around 3:30 p.m., Dukes left her motel room and stumbled to the front desk, appearing lethargic and talking out of her head, pleading for help. Recognizing that Dukes was in medical distress and not acting like herself, the desk clerk, a woman named Stephanie, who knew Dukes from her extended stay at the motel, immediately called 911 for an ambulance. This call went out at 3:41 p.m., reporting a guest who was incoherent and lethargic, classic signs of medical emergency, possibly diabetic shock. Emergency responders arrived minutes later, and by 3:57 p.m., the name of the county is Cocke County, Cocke County Sheriff's Office deputy was on scene along with EMS personnel. Stephanie quickly informed the responders that Dukes was diabetic and likely off her medications. Duke was so confused that she couldn't even recall basic information like her birth date, and she struggled to communicate with EMTs. Concerned for her condition, responders helped carry Dukes to an ambulance, and at roughly 4:09 p.m., Katrina Dukes was rushed to Newport Medical Center for urgent evaluation and care. Guys, not that it makes it any better, but the name of the county is either Cocke, C-O-C-K-E, or Cocke. I think it's Cocke, like Rocky, but Cocke. It's just a unique name. So now you have the hospital treatment and sudden arrest. So at Newport Medical Center, doctors confirmed what the motel clerk had suspected. Dukes was in the throes of a diabetic crisis. Hospital records later showed she was treated for dangerously high blood pressure, so hyperglycemia, and related complications of diabetes. Medical staff also ran a comprehensive drug screening to check if any substance might be causing her confusion. The results were telling. Dukes tested negative for all major drugs and alcohol, including opiates, amphetamines, cocaine, THC, PCP, benzodiazepines, and alcohol. In other words, there was no evidence of intoxication or drug use. Her condition was purely medical. Doctors stabilized her blood glucose and noted a diagnosis of diabetes mellitus with hyperglycemia before discharging her. Now, by 7:40 p.m. that evening, just a few hours after arrival, Katrina Dukes was released from the hospital with instructions for managing her diabetes. The discharge, only a few hours, raises question about whether Dukes was adequately stabilized. She had presented in severe confusion, was a known diabetic who hadn't been taking her medications, and was living in a motel, all risk factors that typically warrant cautious discharge planning. Stabilized blood glucose doesn't necessarily mean normal levels, and emergency departments often discharge diabetic patients who still require careful monitoring. Whether the hospital adequately assessed Duke's mental status, her ability to manage her condition, or her access to medications remain unclear. More critically, what happened immediately after discharge suggests her condition may not have been as stable as the hospital believed. However, Duke's ordeal was far from over. Shortly after discharge, around 7:42 p.m., trouble arose again. Court documents state that an employee of Newport Medical Center called 911 to report that a recently discharged woman, Dukes, was outside the hospital behaving oddly. According to the lawsuit, the caller claims she was asking passerbys for a number to get a fix and seemed disoriented, not knowing who she was or what was going on. This moment represents a critical failure point. A patient who had just been discharged for a diabetic emergency was now exhibiting continuing confusion and disorientation outside the emergency department, classic signs of inadequate glycemic control. Rather than bringing her back inside for reassessment, the hospital employee interpreted this as drug-seeking behavior and called law enforcement. In the context of East Tennessee's opioid crisis, such reports for emergency departments are not unusual. Staff frequently encounter individuals seeking drugs, but the decision to call police rather than readmit a recently discharged patient exhibiting continued medical distress set in motion a tragic chain of events. It's worth noting that the lawsuit does not name Newport Medical Center as a defendant, focusing instead on law enforcement failures. However, the hospital's role, both the discharge decision and the employee's 911 call, represent the first domino in what would become a fatal cascade, at least what I saw. Newport police officer Weber responded and found Dukes just outside the hospital door. She was indeed mumbling and speaking incoherently, clutching what appeared to be her hospital discharge paperwork in hand. Officer Weber asked if she had been at the hospital, and Dukes managed to say yes, even trying to show him her paperwork, seemingly trying to ask for further help. By all accounts, she was polite, cooperative, and posed no threat. Her primary condition was confusion and physical instability. Despite these clear medical red flags, Officer Weber made a fateful decision. He arrested Katrina Dukes on the spot for public intoxication. And under Tennessee law, public intoxication is meant to apply when someone in a public place is under the influence to a degree that endangers themselves or others or causes disturbance. From Officer Weber's perspective, several factors may have influenced his decision. He knew Dukes from prior encounters and mentioned he had arrested her in the past on drug-related charges. In a region grappling with widespread substance abuse, officers frequently encounter individuals whose confusion and impairment stem from drug use rather than medical conditions. The symptoms can be remarkably similar. Slurred speech, disorientation, and unsteady gait can indicate either intoxication or medical distress. Officer Weber categorized Dukes as appearing high as hell and unable to function properly, as he later indicated to a fellow officer. From his viewpoint, based on his previous interactions with her and his observations that night, he believed she was under the influence. However, several critical facts contradicted this assessment. Dukes had just left the hospital where she had been treated for a diabetic emergency and had tested negative for all drugs and alcohol. She was attempting to show the officer her hospital discharge paperwork. So that's evidence of her medical treatment. She appeared confused and disoriented, which are also symptoms of ongoing diabetic complications, not necessarily intoxication. Whether the officer was aware of her negative drug screen results or simply chose not to believe them remains unclear. What medical records suggest is that Dukes' incoherence was consistent with her ongoing medical condition, possibly her blood sugar still fluctuating to other complications, not intoxication. As Officer Weber escorted the dazed woman to his patrol car, another Newport officer, Shelton, arrived. Weber briefed Shelton that he knew Dukes and expressed his belief that she's high. No one called for medical aid or took her back inside the ER just a few feet away. Instead, Katrina Dukes went weak, so she was weak, recently hospitalized and still in a state of confusion, was handcuffed and taken to the Cocke County Jail. So now you're detained in Cocke County Jail. That's where we're at now. Upon arrival at the Cocke County Jail that night, so that's February 29, 2024, Dukes was subjected to the standard intake process. Jail staff noted that she was so impaired that she was unable to sign the intake paperwork. Still, they processed her into custody. The jail medical intake form recorded that Dukes appeared to be under the influence of some drug or alcohol, matching the officer's assumptions. However, according to the lawsuit, critical information about her health and recent hospitalization was either denied or left unmarked on the intake form. Court filings allege that the form failed to properly document that she had any withdrawal symptoms, any history of substance abuse, any current medications, or any recent hospital stay. In reality, she had just come from the hospital and was a known diabetic requiring medication, yet none of that was properly noted. Whether this represented failure of the intake process, miscommunication from the arresting officers, Duke's inability to clearly communicate her medical history in her confused state, or some combination of these factors remains a point of dispute. What is documented is that critical medical information did not make it onto her intake form. After booking, Dukes was placed in a holding cell to be monitored. At approximately 8:22 p.m., jail staff did at least check one vital sign, her blood glucose. This represented a positive step, recognizing that some medical monitoring was warranted and taken action to assess her condition. The reading was alarmingly high, 360 milligrams DL, confirming that her blood sugar was still far above normal despite the earlier hospital treatment. A blood sugar at that level indicates significant hyperglycemia, which can cause confusion, fatigue, and if untreated, can progress to a diabetic emergency. So the critical misinterpretation, why a blood sugar of 360 didn't change the plan, because when I saw that, I said, well, wouldn't they automatically know that now maybe she is going through something that's diabetic related? And here lies one of the most crucial failures in Katrina Dukes' case, a failure rooted not in malice, but in what medical and correctional professionals called, I got this term, diagnostic fixation. By the time jail staff checked Dukes' blood glucose, the diagnosis had already been made. She had been arrested for intoxication. Intake notes had already labeled her as under the influence. Officers believed she was nodding out from drugs. And in that context, the blood sugar check wasn't being used to diagnose her condition. It was being used to confirm or rule out something secondary to what they've already decided was happening. The mindset was likely, she's high, let's just make sure it's not something else. This distinction matters enormously. Once that mental framework was established, the 360 reading was treated as a note rather than a warning. To understand why, it's important to recognize how custody staff are trained to think about different medical emergencies. So overdose is equal to immediate death risk, requires instant action. Low blood sugar equals well understood emergency, act now. High blood sugar equals dangerous, but often misunderstood as needs medication rather than needs emergency transport. Many officers and correctional staff know that low blood sugar is an emergency, but high blood sugar doesn't trigger the same panic response in jail culture. A reading of 360 is understood as high, but not immediately grasped as this person is dying right now. This represents a critical training gap. Moreover, most jails are not equipped to treat diabetes beyond documenting it. They typically do not carry insulin for unscheduled use, do not allow custody staff to administer insulin for rightful reasons, and require a doctor's order, nurse assessment, or hospital transport for diabetic treatment. So when staff saw the 360 reading, the thinking likely was, okay, she's diabetic, but we can't treat that right now, rather than this is a medical emergency requiring immediate transport. This wasn't stupidity. It was a systemic failure, a combination of inadequate training, insufficient protocols, and the overwhelming influence of the initial intoxication diagnosis that had already been locked in. By 8:38 p.m., a jail officer, Edson, conferred with a supervisor, Sergeant Hampton, about Duke's state. They decided to administer Narcan, that's naloxone, a medication that can reverse opioid overdoses, under the assumption that she might have opioids in her system, causing her stupor. This decision reflects both the challenges and the context facing correctional officers in the midst of an opioid epidemic. Cocke County, like much of East Tennessee, has been devastated by opioid abuse. Jail staff regularly encounter inmates experience genuine overdoses, and Narcan has become a critical life-saving tool in these facilities. The nodding out behavior Dukes exhibited is indeed hallmark of opioid intoxication. So in jail culture, Narcan has become the default response because it's fast and familiar. It's perceived as can't hurt, might help. It covers liability if someone might be overdosing. and overdose prevention is heavily prioritized in training. The logic becomes, if this is drugs, Narcan fixes it. If it's not drugs, Narcan won't hurt her. From the officer's perspective, given what they believed about Duke's history and what they were observing, administering Narcan may have seemed like a reasonable, even potentially life-saving intervention. However, the decision to administer Narcan was made despite evidence to the contrary. According to the lawsuit, Dukes had repeatedly told officers she wasn't on drugs and didn't need Narcan, and she even tried to resist the injection, physically struggling against Sergeant Hampton's attempt to give it. Court filings state she repeatedly said she was not on drugs, not coming off drugs, and did not need Narcan. Whether her protests were clearly articulated given her confused state, or whether officers dismissed them as typical denial from someone they believe was intoxicated, remains unclear. But at 8:45 p.m. on February 29, Sergeant Hampton, after consulting a lieutenant, went ahead and injected Dukes with the first dose of Narcan. Now, mind you, staff is trained to do that. Custody staff is trained to do that. The supervisor is trained to do that. Either it's the underneath the nose or they do the shot. And mind you, what's disturbing is when you watch this video, you could see that she's trying to get her thoughts out, but she can't. And that could be definitely related to someone having a stroke. But again, it does make sense to have that confusion too. I mean, they're so used to people dealing with people that are high, and they get caught in that bias. So this is, you know, in tragedy, if you can learn something, this is good for some retraining. Everything should be treated as universal precaution, but which way does the universal precaution go? I mean, does it mean the person's constantly high and that's what we try to, you know, continue with? Or, hey, you know what, since the Narcan's not working and she still seems a little off, maybe it's something else. So maybe when they did the check for the sugar, the what was that, the 360, is that milligrams, DL? I just want to make sure I'm giving you guys the right number. Where am I? Well, when they did the test, then maybe now the secondary becomes the primary. You know, you got to know when to adapt and adjust. And that's kind of what this next part's about, the failure to pivot when Narcan didn't work. So predictably, the Narcan didn't improve her condition because she had no opioids in her system, as her hospital toxicology screen had confirmed hours earlier. This is where the failure became most critical. Best practice in correctional and medical settings dictates a clear sequence. Narcan administered goes to immediate reassessment. No response to Narcan, change diagnosis. Change diagnosis, call medical staff or EMS. What appears to have happened instead was a continuation of the original assumption. Narcan administered, no response. Conclusion, she's still high. Action, watch and wait. This is classic diagnostic fixation, the tendency to lock onto an initial diagnosis and filter all subsequent information through that lens, even when evidence contradicts it. Sergeant Hampton noted that they would have to monitor her through the night since she was still not acting like her normal self. The jail staff were familiar with Dukes from prior minor incarcerations. In essence, the plan was to let her sleep it off in the cell under the mistaken belief she was high. No doctor was called. No one gave her insulin for her extremely high blood sugar, nor did anyone arrange to take her back to the hospital for further evaluation that night. Several factors likely contributed to this failure to escalate. Dukes had a documented prior drug history. She was confused and had resisted the Narcan. Staff were operating after hours when medical may not have been physically present. Stroke symptoms hadn't fully declared themselves yet. And custody culture prioritizes overdose prevention over metabolic emergencies. None of these factors excuse the failure to recognize a medical emergency, but they help explain the system-level breakdown that occurred. The critical question remains whether the failure to provide further medical intervention after Narcan proved ineffective represented a breakdown in protocol that violated Duke's constitutional rights. The lawsuit argues that once Narcan failed to work, staff should have immediately recognized their initial diagnosis was wrong and called for emergency medical help. That escalation never happened. Jail officials later claim, according to the lawsuit, that Dukes appeared normal the next morning during breakfast on March 1st. If this claim was made, it might indicate a brief period where she seemed somewhat stable. However, any apparent improvement did not last. In reality, Katrina Dukes' health was spiraling downhill in custody, and critical warning signs were about to emerge. So as March 1st, 2024 progressed, Katrina Dukes' condition worsened dramatically. Hospital records show that jail personnel first noticed signs of trouble around 11:30 a.m. Dukes' speech was altered and her coordination deteriorating. These symptoms should have been immediately concerning. Altered speech and deteriorating coordination can indicate a stroke, a life-threatening diabetic emergency, or other serious neurological events. By the afternoon, around 3:30 p.m., her symptoms had grown severe. Her speech was slurring more, and she was becoming minimally responsive. One side of her face was weakening as she had trouble moving the right side of her body, textbook sign of a stroke. Despite these alarming developments, there is no indication that jail staff immediately called 911 or rushed her to a hospital at that time. The reason for this delay are not publicly documented. It's possible that staff still operating under the assumption that Dukes was experiencing drug-related issues, interpreted these worsening symptoms as part of withdrawal or continued intoxication rather than recognizing them as medical emergency. It's also possible that understaffing and inadequate training in recognizing stroke symptoms or other systemic issues within the jail contributed to the delayed response. Whatever the cause, hours passed in which Dukes remained in her cell while her condition deteriorated. It wasn't until 4:36 p.m. on March 1st that the crisis could no longer be overlooked. Another inmate yelled for the officers, alerting them that the lady on the floor needed help. Katrina Dukes had collapsed onto a concrete floor of her cell, non-responsive. Jail staff finally sprang into action. Lieutenant Garrell, upon seeing Dukes on the ground with obvious paralysis and an inability to speak, called 911 at 4:57 p.m. to report that an inmate was showing stroke-like symptoms. Before ambulance arrived, the jail nurse arrived at the cell. Court documents indicate that the nurse response was to administer Narcan yet again, not once or twice, but 3 more times in rapid succession. She gave Duke doses of Narcan at 4:50 p.m., 4:55 p.m., and 5 o'clock p.m., according to the records. This made 4 doses of Narcan in total that Dukes was given during her roughly 20 hours in custody. This repeated administration of Narcan, even as Dukes lay collapsed with obvious stroke symptoms, demonstrates the depth of the diagnostic fixation that had taken hold. Despite clear evidence of a neurological emergency, facial drooping, one-sided paralysis, inability to speak, the working diagnosis remained drug overdose. This suggests either a fundamental misunderstanding of Duke's condition or a rigid adherence to the initial diagnosis despite overwhelming evidence to the contrary. While Narcan itself is generally safe, if opioids are not present, its repeated use without clinical reassessment can delay recognition of other life-threatening conditions. Each dose delayed other potentially life-saving interventions. The time spent administering it and the failure to immediately transport Dukes to emergency care may have cost crucial minutes in a situation where every moment mattered. At 5:03 p.m., Newport's fire department first responders arrived at the jail, followed by EMS paramedics at 5:17 p.m. At last, Katrina Dukes was taken out of the jail on a gurney and transported back to Newport Medical Center, the same hospital that had treated her just the day before. The medics noted she was in critical condition. She was awake but largely unresponsive with one-sided facial drooping and paralysis, all clear signs of a major stroke. And what's the final outcome here? In Newport Medical Center ER, doctors quickly recognized the severity of Duke's condition. She had altered speech, impaired coordination, a reduced level of consciousness, and an inability to move her right side. A CT scan confirmed their fears. Katrina Dukes had suffered a stroke on the left side of her brain, which explained the right-sided paralysis and speech loss. Medical records indicate this appeared to be an ischemic event, blocking blood flow in the left brain artery, a life-threatening and time-sensitive condition. Stroke patients typically need immediate clot-busting treatment or specialized intervention like a thrombectomy within hours to have a chance at recovery. The medical community often speaks of a golden hour or critical window for stroke treatment, but Dukes had been in her jail cell for many hours while her stroke progressed. Doctors noted that jail staff reported her neurological symptoms had started around 11:30 that morning and grew much worse by 3:30 p.m., yet she only got to the ER after 5:30 p.m. Those lost hours are central to the family's claim of inadequate medical care. Realizing they lacked the advanced neurosurgical resources on site, Newport Medical Center arranged to transfer Dukes to the University of Tennessee Medical Center in Knoxville for specialized stroke care, including a possible thrombectomy to remove the clot. At 6:51 p.m., a critical care ambulance was dispatched for the 50-mile emergency transport with lights and sirens blazing. Katrina Dukes arrived at UT Medical Center around 9:29 p.m. on March 1st, 2024, finally in the hands of top-level stroke unit. Tragically, the belated medical intervention came too late. For 2 more days, doctors fought to save Dukes' life at UT Medical Center, but the damage to her brain was catastrophic. On March 3rd, 2024, Katrina Dukes died in the hospital from complications of the massive stroke. She was only 40 years old. What began as a treatable diabetic episode had cascaded into a fatal neurological injury. The timeline was stark. Within roughly 24 hours of being arrested, Dukes had collapsed and suffered an irreparable brain injury, and within 48 hours, she was dead. Medical records clearly indicate the cause: stroke brought on by untreated medical condition and delays in care. The lawsuit filed by her family states that she passed away from complications caused by stroke. Whether earlier intervention, either by not arresting her at all, by properly treating her diabetes in custody, or by promptly recognizing and responding to stroke symptoms, would have saved her life remains a central question in this ongoing litigation. Now we want to get to the family's lawsuit and allegations of negligence. On February 28, 2025, so almost a year, nearly 1 year after Katrina Dukes' death, her mother, Deborah Jenkins, filed a comprehensive wrongful death and civil rights lawsuit seeking accountability. The suit names a long list of defendants: Cocke County and its sheriff's office, CCSO, the city of Newport and its police department. Okay, the suit names a long list of So we have Cocke County and its sheriff's office, the city of Newport and its police department, several individual officers from both agencies, including Officer Weber, who arrested Dukes, jail deputies Edson and Hampton, and Lieutenant Gorell, and supervisors, the jail's medical provider, and the jail's nurse who administered the multiple Narcan doses. In essence, every entity and person involved in Dukes' arrest, detention, and care is being held to account for what her family calls a preventable tragedy. The lawsuit paints a harrowing picture of systemic failures and alleged constitutional violations. It asserts that Katrina Dukes' rights were violated at every turn, from an unlawful arrest to deliberate indifference to her medical needs. Key allegations include wrongful arrest. So according to the lawsuit, Officer Weber had no valid reason to arrest Dukes in the first place. Court filings state that Dukes was experiencing a medical emergency and explicitly told the officer she needed help, even holding up her hospital papers as evidence. Despite knowing she'd just come out of the hospital, Weber falsely placed her under arrest for public intoxication, the suit claims. The family contends this was not just a mistake, but a reckless and callous act, treating a medical patient as a criminal. Public intoxication charges in Tennessee are misdemeanors and are discretionary. Officers are expected to use judgment and, when safe, get medical aid for someone in distress rather than jail them. However, officers also face difficult judgment calls in the field, particularly when dealing with individuals who have prior drug-related histories and who are exhibiting behavior that could indicate intoxication. The lawsuit argues that, in this case, the discretion was tragically misused, particularly given that Dukes had just been medically cleared and discharged from a hospital. And then there's deliberate indifference to medical needs. Once in custody, Dukes' constitutional rights under the 8th Amendment ban on cruel and unusual punishment and the 14th Amendment due process for pretrial detainees guaranteed her the right to adequate medical care. According to court filings, jail staff and officials showed deliberate indifference to her serious medical condition. Despite obviously serious medical needs that developed in front of them, officers and the nurse allegedly failed to provide appropriate treatment. The complaint emphasizes that no real medical care was given for many critical hours. She received no medication for her diabetes, no hospitalization when stroke symptoms appeared, and no meaningful monitoring beyond the initial blood glucose check. Instead, the lawsuit alleges they improperly and repeatedly gave her Narcan and ignored classic stroke symptoms. The complaint emphasizes that even a layperson should recognize signs of a stroke or severe medical distress and summon help, let alone train jail staff. So basically, the complaint emphasized that even a layperson should recognize signs of a stroke or severe medical distress and summon help, let alone train jail staff. So they're held to a higher level of accountability. By ignoring those signs, the lawsuit contends the defendants violated a fundamental duty. Dukes' family says this negligence was so egregious it amounted to cruel and unusual punishment, causing her needless pain and suffering and ultimately her death. And then you have the failure to follow protocols. The lawsuit highlights that Cocke County and Newport authorities allegedly failed to have or follow proper policies for handling inmate medical emergencies. For instance, officers should have protocols for distinguishing a diabetic episode or stroke from intoxication, as the symptoms can be similar. So low or high blood sugar, as well as stroke, can cause slurred speech and confusion, which police sometimes misread as drunkenness, a known issue in law enforcement. Proper protocol, the lawsuit argues, would have been providing appropriate medical care, making proper observations, and transferring a prisoner with stroke symptoms to a hospital immediately. Instead, court filings claim they did none of these things. The suit notes that even if staff generally thought she overdosed, They still mishandled it. Narcan was given with no follow-up care or medical evaluation, and they did not even confirm an overdose with a toxicology test or hospital call. Essentially, the lawsuit alleges that basic procedures were either not in place or were ignored. And then you have the knowledge of her condition. One particularly damning assertion is the lawsuit in the lawsuit is that everyone involved knew or should have known Dukes' true condition. The defendants were familiar with Dukes according to court filings. She was known to have medical conditions, specifically diabetes, and not known as a heavy drug user. Officer Weber and jail staff were aware she had just been discharged from the hospital when they took her in. In fact, the lawsuit indicates that her hospital discharge papers were provided to jail staff upon arrival. Those papers likely included her diagnosis and negative drug tests, critical information that appears to have been utterly disregarded. The family lawsuit underscores this point to show that the neglect wasn't an innocent mistake, but a conscious choice to ignore the facts in front of them. Court filings state that Dukes herself, even in her confused state, begged them to believe she wasn't on drugs and to get her medical help instead. And then you have pain and suffering. The complaint also seeks damage for the immense pain, fear, and suffering Katrina Dukes endured in these final days. It describes how she endured conscious pain and suffering, fear of impending death, severe emotional trauma, shock, embarrassment, and humiliation as a direct result of being neglected in custody. One can only imagine the terror she felt, awakening periodically in a jail cell, half her body becoming paralyzed, unable to speak properly, and not receiving the help she knew she needed. This element of the suit speaks to the human tragedy of what happened beyond the medical facts. In legal terms, the lawsuit brings claims under 42 U.S.C. subsection 1983, the federal civil rights statute, for violation of Dukes' constitutional right. It alleges the officers and jailers acted knowingly, intentionally, and with reckless indifference to her serious medical needs. It also includes state law claims for wrongful death and negligence. The family seeking unspecified compensatory damages for the loss of Dukes' life and her suffering, as well as punitive damages to punish the agencies involved. Deborah Jenkins, as mother of the deceased, has made it clear she wants systemic changes so that no other families endure what hers has. The defense perspective. Now, this is coming from the Sheriff's Department. As of the time of reporting, the defendants, Cocke County Sheriff's Office, Newport Police, and others have not made detailed public comments on the lawsuit. This silence is standard legal practice during pending litigation. When pressed by media, agencies typically cite ongoing investigation or defer to legal counsel to avoid making statements that could affect the case. It's common in such lawsuits for defendants to argue several points that officers and jail staff acted in good faith based on the information available to them at the time, that the symptoms of intoxication and medical emergencies can be genuinely difficult to distinguish, particularly in individuals with histories of substance abuse, that staff followed established protocols given their training and resources, and that any failures were the result of tragic misunderstanding rather than deliberate indifference or malice. I mean, the last thing you want is negligence or indifference, especially deliberate indifference. In this case, defendants may argue that the opioid crisis context made their initial assessment reasonable, that they did take some medical steps, which is checking blood glucose, administer Narcan, eventually calling for emergency transport, and that resource constraints and training limitations in a rural county jail contributed to the outcome. They may also argue that Dukes' own failure to take her diabetes medication and her confused state made it difficult for her to clearly communicate her medical needs. However, these potential defenses will need to contend with the documented facts that Dukes had just been discharged from a hospital with negative drug screen, and that she told staff repeatedly she wasn't on drugs, that her blood sugar reading confirmed a diabetic issue, that stroke symptoms went unaddressed for hours, and that basic medical protocols appear not to have been followed. Plus, she's in custody. So their number one priority is her safety and well-being. WVLT News reported that it reached out to both the sheriff's office and police departments for comments when the suit was filed, but no immediate response was given. As the case proceeds through the courts, the defendants will have the opportunity to present their version of events and their justification for the decision made. Now, we do have some public and media reaction. Katrina Dukes' death and the circumstances around it have sparked outrage and raised serious public concern in Tennessee and beyond. The case received significant media coverage in early 2025 when the lawsuit was filed, shining a light on the incident after initially being little known. Local Knoxville area media broke the story, emphasizing the shocking misjudgment that turned a medical emergency into a jail death. One headline read, "Lawsuit claims authorities failed to treat woman having diabetic episode, gave her Narcan 4 times." That stark summary spread quickly. News outlets recounted how an incoherent diabetic woman suffering a crisis was wrongfully arrested for intoxication, then suffered a fatal stroke in her jail cell. The sheer irony and tragedy that seeking help at a hospital ended with her dying in custody struck a chord with many readers. On social media and community forums, many expressed anger and sadness. Could this have been any one of us or our loved ones? Diabetics and people with medical conditions in the community voiced particular fear, noting that low blood sugar can look exactly like intoxication, but it's a medical emergency and not a crime, as one commentator put it. The fact that multiple Narcan doses were given despite no evidence of opioid led to public speculation that officers were fixated on drugs to the exclusion of basic medical sense. Some wondered why the hospital staff who called 911 in the first place didn't simply bring Dukes back inside when they saw she was unwell. Others questioned the training of both police and jail staff in recognizing diabetic symptoms and stroke. Narcan has become a life-saving tool in the opioid epidemic, but in this case, it became a red herring, a point not lost on public discussion. And I'll be honest with you, the hospital staff, I think that's a concern. Like, you see her acting this way, they should have brought her right in. But again, they're used to people being high. They want to keep people in the hospital safe. So there's probably a working partnership with them and law enforcement. So if they stayed with the narrative that she was high, then most likely they're bringing her back to the jail where they can supposedly, safely watch her go through, sober up. However, some voices in the community have also expressed understanding of the difficult position law enforcement faces. East Tennessee has been ravaged by the opioid crisis, with overdose deaths climbing year after year. Officers and jail staff encounter generally intoxicated individuals daily, and quick administration of Narcan has saved countless lives in these facilities. The challenge of distinguishing a diabetic emergency from drug intoxication in the field, particularly when dealing with someone with a prior drug history, is real and acknowledged even by critics of how this case was handled. Civil rights advocates and watchdog groups have pointed out that Duke's case is sadly not unique. Across the country, there have been several incidences of law enforcement mistaking stroke or diabetic emergencies for intoxication or drug impairment, sometimes with deadly or life-altering outcomes. In fact, just a month before the Dukes lawsuit was filed, a New Jersey jury awarded $1.5 million to a woman who was wrongly arrested during a stroke. Police there assumed she was drunk, delayed medical care for hours, and left her permanently disabled. In that case, the court noted that while the stroke itself caused harm, the officer's actions greatly exasperate, that word is, I know the word, guys, but I have trouble with words sometimes. Exasperate, basically progressed it forward more rapidly. Her suffering and exasperate, that word gets to me, but basically actions greatly, in that case, the court noted that while the stroke itself caused harm, the officer's action greatly kind of moved it forward. Her suffering and the large verdict sent a message about accountability. Other examples have surfaced. A Canadian man in Calgary was left in a cell for 18 hours during a stroke, and in Louisiana, a man died months after paramedics allegedly mistook his stroke for intoxication. These parallels have been highlighted by media to underscore a systemic issue. Too often, people exhibiting confusion or slurred speech are presumed to be intoxicated, especially if there's any history or suspicion of drug use, when in reality, they may be in dire need of medical help. In Tennessee specifically, not only has there been this case of Katrina Dukes, but even law enforcement officers themselves have fallen victim to similar mistakes. In one recent incident, retired Tennessee deputy suffered a diabetic crash while driving and was arrested for DUI by a state trooper who misread the situation. Body cam footage captured the trooper candidly admitting, "I don't know what to do," as the older man insisted he was not drunk but in medical distress. These stories have fueled calls for better training of police in medical emergencies. As a medical news outlet noted, officers are often the first responders on scene, and basic knowledge of medical conditions like strokes could help officers identify and respond more appropriately, reducing the risk of misjudging a medical emergency as intoxication. The public sentiment is that no one should be handcuffed and left to deteriorate from a stroke or diabetic coma when timely care could save their lives. The Katrina Dukes case has also intensified scrutiny on the Cocke County Jail and its history. Local media investigations revealed that this was not the first troubling incident at the Cocke County facility. The jail has for years been plagued by overcrowding, understaffing, and inadequate conditions. In fact, the Tennessee Correctional Institute, TCI, decertified the Cocke County Jail in 2017 due to poor living conditions for inmates, overcrowding, and understaffing. During an inspection that year, officials observed rotting ceilings, holes in the floor, and leaks in the jail infrastructure. Though some improvements have been attempted since, the jail remains a source of concern. As the former sheriff himself admitted, a jail is a community's largest liability when it comes to lawsuits. It's not a new issue. Indeed, Katrina's death is one of several incidents in recent memory to result in legal action against Cocke County. In 2020, an inmate named Kelsey Wolf died in the Cocke County Jail, and his estate filed a $32 million lawsuit alleging that jail staff failed to provide basic treatment and did not properly evaluate him during intake. In another case, a 32-year-old woman named Amanda Lee Hill died in the jail in 2019 after being held on a probation violation. Her death also led to a wrongful death lawsuit and was one factor in the jail briefly losing its state certification. And in 2022, a former inmate sued after he was brutally beaten by other prisoners and allegedly left without medical care for 12 hours, citing the jail's chronic understaffing and lax oversight. These cases, including that of Kristina Dukes, suggest a pattern of neglect and insufficient medical attention at the facility. Public concern in Cocke County has grown, with citizens and some officials calling for reforms, whether it's better training, more medical staff on site, reducing jail crowding, or improved protocols for health emergencies. The lawsuit, while seeking compensation for grieving families, also aims to force change in how the jail and local police operate. It's important to note that Cocke County is not unique in facing these challenges. Rural jails across Tennessee and the broader United States struggle with limited budgets, difficulty recruiting qualified medical staff, aging facilities, and the competing demand of the opioid crisis. These systemic issues don't excuse the failure alleged in Duke's case, but they provide context for understanding how such tragedies can occur and what broader changes might be needed. Now, the tragedy of Katrina Dukes' death touches on several broader policies and procedural issues in law enforcement and correctional care. So one is the recognition of medical emergencies. A central issue is how police and jail personnel distinguish a medical crisis from intoxication or drug impairment. Duke's case illustrates the potentially deadly consequence of misclassification. Diabetic hypoglycemia or hyperglycemia, strokes, seizures, and other conditions can outwardly resemble intoxication, slurred speech, confusion, unsteadiness. Officers are not expected to be doctors, but they are expected to have basic first responder training. In Tennessee, police recruits do receive some training in handling medical emergencies, and many departments have policies that if someone appears ill, even if intoxicated, they should be evaluated by medical professionals before booking. The question in this case is whether that training was adequate and whether established policies were followed. The Newport officer's decision to arrest Duke straight from the hospital rather than escort her back inside for evaluation or call for EMS assessment represents a critical juncture. Experts suggest law enforcement agencies should strengthen training on recognizing diabetic crisis and strokes and err on the side of medical treatment, particularly when someone has just been discharged from medical care and is still exhibiting symptoms of distress. As one analyst put it, police often could be the difference between life and death. So even a few hours of EMS training and identifying stroke symptoms could save lives. Some law enforcement professionals have advocated for simple protocols: facial drooping, arm weakness, speech difficulty, and time to call 911. The FAST acronym for stroke recognition. So FAST, facial drooping, that's the F. A for fast is arm weakness. S is speech difficulty, and T is time to call 911. Similarly, diabetic emergencies can often be identified with simple questions about medical history and, if available, a quick blood glucose check, equipment that some police departments now carry. The public outcry from this case has amplified calls for such training improvement, not just in Cocke County, but statewide. The use of Narcan versus proper medical care. The overuse of Narcan in Duke's case highlights a procedural lapse that carries broader implications. Narcan, naloxone, is a life-saving antidote for opioid overdoses, which is why many police and jail staff now carry it, especially in areas hit hard by opioid abuse. Its widespread availability has saved thousands of lives across Tennessee and the nation. However, protocol generally dictates that if Narcan is administered and the patient does not respond, medical escalation is needed because either it's not an opioid issue or something else is very wrong. Here, after the first Narcan dose failed to revive or markedly improve Dukes at 8:45 p.m. on February 29th, it should have been a red flag that her condition wasn't an overdose. Instead, the jail essentially let her condition simmer all night. Then as her condition turned dire the next day, they gave 3 more doses of Narcan instead of immediate advanced care. This suggests a lack of clear medical protocol or training in the jail. Many are asking whether Cocke County Jail had any guidelines for when to call an ambulance versus trying repeated Narcan. According to the lawsuit, no appropriate protocol was in place for prisoners with medical emergencies such as a stroke and admissions that allegedly violated Duke's rights. Going forward, this case may prompt jails to adopt stricter rules. For instance, if 1 dose of Narcan doesn't awaken the inmate immediately, call for emergency medical transport and assume it's not a simple overdose. These lost hours are a key focus of the family's litigation, which argues that Duke's life might have been saved if such a rule have been followed. Medical professionals have also known that while Narcan itself is generally safe, if opioids are not present, its repeated use without clinical reassessment can delay recognition of other life-threatening conditions. The drug has become so associated with the opioid crisis that some first responders may reach for it reflexively, even when other medical emergencies should be considered. And then you have understanding diagnostic fixation in correctional settings. The Dukes case powerfully illustrates a phenomenon that medical and correctional professionals recognize, but that the public doesn't often understand, which is diagnostic fixation or anchoring bias. This occurs when decision makers lock into an initial diagnosis and unconsciously filter all subsequent information through that lens, even when mounting evidence contradicts it. In correctional settings, this bias can particularly be dangerous because staff are trained to be suspicious and expect deception. The opioid crisis has made overdose the default assumption for many symptoms. Jails lack the diagnostic tools available in hospitals. Time pressure and understaffing limit thorough reassessment, and prior criminal history influences perception of current behavior. What should happen when initial intervention fails? Best practice requires a deliberate diagnostic reset, stepping back to reconsider all possibilities when treatment doesn't produce expected results. In Duke's case, that reset never occurred. Each failed Narcan dose should have prompted the question, if this isn't an overdose, what else could it be? Training programs increasingly emphasize this concept of reassessment triggers, specific moments when staff must consciously reconsider their working diagnosis. The failure of Narcan to produce any response is precisely such a trigger. The appearance of new symptoms, facial drooping, one-sided weakness, should force a complete diagnostic rethink. Implementing these forced pause protocols could prevent future tragedies. Simple checklists, similar to those used in aviation and surgery, can help correctional staff overcome their own cognitive biases and recognize when they've anchored on the wrong diagnosis. And then you have jail medical staffing policies. Another systemic issue is the adequacy of medical care in county jails. In Tennessee, county jails are required by the Tennessee Correctional Institute standard to provide medical screening at intake and assessment to treatment. Cocke County Jail did perform an intake screening for Dukes, but according to the lawsuit, it was perfunctory at best and failed to properly document critical information about her recent hospitalization and diabetic condition. The jail did have a nurse on duty, but whether she was on site continuously or on call is unclear from available information. Even the event suggests that for a large portion of Duke's custody overnight, no medical professional was actively monitoring her. Her condition was left to correctional officers who lacked medical expertise. Only when she collapsed did the nurse intervene, and even then the response was flawed. Tennessee does not mandate a doctor on site at jails, but a nurse or EMT on staff is common. The case raises the question, were jail medical staff properly trained to handle strokes or diabetic cases? And court filings argue that the county failed to train and supervise its staff in basic life-saving procedures. In broader terms, it points to how under-resourced some jail medical units are, particularly in rural counties with limited tax bases and competing budget priorities. If a jail cannot safely manage someone with diabetes or other common conditions, they arguably should transfer them to a facility that can, or not detain them at all for minor charges. Policies in some jurisdictions dictate that anyone arrested solely for public intoxication or a low-level charge who is exhibiting medical issues must be cleared by a hospital before being accepted into the jail. If Cocke County had such a policy, it wasn't followed. And if it didn't, many believe it should implement one now. The challenge for rural jails is real. Recruiting qualified medical staff to work in a correctional center is difficult, particularly in areas where healthcare professionals are already in short supply. Pay is often lower than in hospital settings, and the work environment can be challenging. These systemic issues don't excuse failures or in individual cases, but they highlight the need for state-level support and oversight to ensure minimum standards are met. And then we have accountability and oversight. Katrina Dukes' death also spotlights the systems of accountability for in-custody care. In Tennessee, when someone dies in jail custody, typically the Tennessee Bureau of Investigations, TBI, can be called in to investigate. It's not publicly reported whether TBI investigated this case at the time of death, perhaps because she technically died at the hospital, not inside the jail cell. The case might have been viewed as a medical death. The lack of immediate spotlight on the incident in 2024 suggests it might have been quietly classified as a natural medical death. The lawsuit has forced belated accountability. It is now prompting state and local officials to ask if Cocke County follows state jail standards and whether any state oversight mechanism failed. And the Cocke County Sheriff's Office, for instance, is responsible for jail operations and could face internal discipline or policy changes as a result. Already, the string of lawsuits against the jail, so you have Wolf's Hills, Dukes, etc., is causing public officials to consider facility upgrades and better training. Some advocates argue that independent monitoring of troubled jails is needed. Others point out that litigation, while costly for taxpayers, may be the only effective tool to force change if internal oversight is lacking. And the Dukes family suit explicitly states, not just damages, but also implicitly aims to pressure Cocke County to never let this happen again, whether the litigation will result in meaningful policy changes or simply financial settlements remains to be seen. And then you have law enforcement procedures for public intoxication. At a higher level, Duke's case invites discussion about how police handle suspected public intoxication, especially when no other crime is occurring. Newport police arrested her based on a hospital employee's report that she was asking for a fix and appeared disoriented outside the emergency department. Public intoxication in Tennessee is somewhat subjective. It doesn't require a specific blood alcohol level or drug test, just an officer observation that a person is impaired in public and a potential danger or nuisance. This gives officers considerable discretion, which is both necessary, allowing them to respond appropriately to varied situations, and potentially problematic, which creating an opportunities for misjudgment or bias. Critics of the arrest in this case note that the officer's discretion could have been used to get medical help instead. In some jurisdictions, officers in such scenarios can opt to take an individual to an emergency room or detox center instead of jail. Newport officers chose jail and a criminal charge, which is hindsight was the worst possible option. The lawsuit suggests this choice was so unreasonable it violated her rights. It raises the question, should Tennessee revisit how public intoxication laws are applied to ensure they aren't misused against people in medical crisis? Some have suggested that police departments enact a policy, when in doubt, call EMS. A person acting strangely outside a hospital of all places should likely have been turned back over to doctors, not put behind bars. However, officers also face practical challenges. Emergency departments are often overwhelmed and may be reluctant to readmit someone they just discharged. Officers dealing with frequent repeat offenders may become skeptical of claims of medical distress, and the pressure to do something when a 911 call has been made can push towards arrest as the default option. So I'm trying to provide every perspective. These realities don't justify the outcome in Duke's case, but they highlight the need for clear policies, better interagency communication between police and hospitals, and ongoing training that emphasizes medical assessment over reflexive criminalization. This case may serve as a case study in police academies and jail training programs of what not to do, but more importantly, of what should be done when facing similar situations in the future. And as for the conclusion, this will wrap everything up. In the end, the story of Katrina Dukes is a heartbreaking example of systemic failure at the intersection of policing, healthcare, and custodial responsibility. It highlights how diagnostic fixation, insufficient training, resource constraints, and systemic neglect can turn a treatable condition to a death sentence. To put it simply, they did check her blood sugar and it was dangerously high. But once she already been labeled as intoxicated, that number didn't change the plan. Narcan felt safer and more familiar than recognizing a diabetic or neurological emergency. And when Narcan failed to work, no one stopped to ask the critical question, what if we're wrong? Dukes did what we hope anyone would do in a health crisis. She sought help. She went to the front desk of her motel asking for assistance. She was taken to a hospital and treated, yet a cascading series of poor decisions by those entrusted with her care meant that help was denied at every critical moment thereafter. A hospital employee call led to an arrest rather than a medical intervention. Jail staff focused on suspected drug use rather than the documented diabetic emergency, and stroke symptoms went unrecognized or unaddressed for hours. Whether these failures constitute the deliberate indifference alleged in the lawsuit or whether they represent tragic but understandable mistakes in a system strained by the opioid crisis and resource limitations will be for the courts to decide. What seems clear is that somewhere along the line, basic protocols were not followed, clear warning signs were missed, and a woman who should have received medical care instead died in custody. Our family, through their lawsuit, is not only seeking justice for Katrina, but also speaking for broader change. They, along with much of the public, are asking for responsibility and reform. Responsibility for the officers and officials whose actions or inactions led to a woman's death, and reform of the procedures and training so that no one else with a medical emergency is ever treated as Katrina was. As this case proceeds through the courts, it will serve as a test of accountability in the criminal justice system. It will ask whether law enforcement and correctional officials can be held liable when their judgment calls prove tragically wrong. It will examine whether the system in place, training protocols, medical screening procedures, emergency response policies are adequate to protect vulnerable individuals in custody. The case also serves as a somber reminder to law enforcement agencies everywhere that human life and health must be the priority, even if that means admitting a suspect's Admitting a suspect needs a doctor, not a jail cell. The cost of getting it wrong is simply too high, as the death of Katrina Dukes has made painfully clear. For Cocke County, this case adds to a troubling pattern that demands attention. For Tennessee, it raises questions about state oversight of local jails and whether current standards are sufficient. And for the nation, it's another data point in an ongoing conversation about how we handle the intersection of medical emergencies, substance abuse, and law enforcement. Katrina Dukes' death cannot be undone, but if her story leads to change that prevents similar tragedies, better training for officers in recognizing medical emergencies, clearer protocols requiring diagnostic reassessment when initial treatments fail, stronger oversight of troubled facilities, mandatory hospital clearances before jail intake for medical cases, or simply a greater awareness of how diagnostic fixation can be deadly, then perhaps some meaning can be found in this senseless loss. So that was a lot going on there, but there's a lot to look at that we could maybe kind of see if we can address, create an impact. And I love how eventually, as I post this up, the comments start to move towards that direction. So hopefully people who find interest in this also read the comments, because you'll start to see that's where the video grows. That's where the context starts to take off. It's the community that makes what we put up better. Now, guys, if you like the content, please, I do have Buy Me a Cup of Coffee. There's a link to that in my description of the video, also on top of the YouTube channel, and more videos to come. As always, guys, stay safe.